Hello, Vincent Carroll speaking. This is tutorial number 24 about stroke. From a Western medical point of view, stroke can be one of two separate things. Stroke can be a bleed on the brain. In other words, a blowout from an artery supplying the brain, very often secondary to blood pressure. Or stroke can be a clot moving along a cerebral artery until it clots, until it stops, until it can go no further. And therefore, if it can go no further, the cells behind that obstruction will die through lack of oxygenated blood reaching it. So a stroke can be one of two completely separate things from a Western perspective, requiring completely different treatments from a Western perspective. So on the one hand, a person might have a rise in blood pressure and therefore a weak part of a cerebral artery, the artery that supplies the brain, can blow out or can burst. Usually it's an artery damaged with cholesterol, and the blood will bleed over the surface of the brain, and that part of the brain will cease to function, creating functional loss within the body. On the other hand, a clot can break away. Very often a portion of cholesterol can break away. It will tumble along, being pushed forward by the blood until such time that it reaches an obstruction. The arteries get narrower and narrower and narrower. And then when the blood reaches a point that it cannot progress beyond, then at that point everything behind that obstruction dies through anoxia, through lack of oxygen reaching the brain cells beyond the obstruction. So they're two very separate different things. From an acupuncture medical point of view, what's going on? Well, I often see stroke as a form of liver yang rising, the ultimate, I suppose, and most tragic manifestation maybe of liver yang rising. What often happens from an acupuncture traditional medical point of view, we're talking, of course, about wind. Because of the origins of acupuncture within an ancient agricultural community, the effect of wind was something that was very, very important in society in that era. And therefore, a wind can blow a tree down and a person will collapse that has a stroke. So therefore, a comparison was immediately drawn. What is happening, of course, is that yang is rising up. And yang can manifest in very, very many different ways. In the vast majority of cases, it does. So, for example, you can have the migraine headache, you can have the tinnitus, you can have the dry itchy eyes, the dry itchy scalp, temporomandibular joint pain, grinding your teeth in bed at night, plum stone in the throat. I could go on and on and on, as all of us could. And these are manifestations of yang rising, and all in the upper part of the body, if only because yang rises, and it rises in the greater yang channels and to a certain extent in the lesser yang channels as well, particularly the sanjiao. So that is the manifestation of yang, and it manifests in these clinical ways, and in a tiny, tiny minority of cases where the yang is excessive, it can blow out, causing the traditional stroke. And therefore I see very much stroke caused by a bleed on the brain as a yang rising event. And can it be prevented? Yes, of course it can, but only by dragging down. I mean, it doesn't come from nowhere. There's always a history before it happens, a history of what we would call or describe as yang rising, or what from a Western medical point of view might be described as maybe high blood pressure leading to headaches, although a lot of blood pressure unfortunately doesn't lead to any symptoms, and that's why it's often viewed as a silent killer. But nonetheless, very often you also have, in addition to perhaps the blood pressure without clinical signs or symptoms, you also have other clinical signs and symptoms that from a Western medical point of view are unrelated to blood pressure, such as migraine headaches and all of that. But from our point of view, we would have enough evidence to say that yang is rising in a chaotic way. The real question is, will yang rise in a catastrophic way? And if that happens, that might present as a stroke. And of course, a certain percentage of strokes cause instantaneous death. A lot of strokes will cause death sometime after the initial stroke, and most strokes will limit life expectancy to a greater or lesser extent. Some people make a full recovery, of course. Regarding the other type of stroke, the less common, I suppose, which is the clot occurring, how is that described from an acupuncture point of view? I see that very much as a stagnation aspect as well, that qi within in the body is stagnant for whatever reason, and that stagnation causes qi to clot, qi to consolidate, for want of a better word, and for that to cause obstruction in a distal part of a cerebral artery. And everything distal to that distal part of the cerebral artery is, of course, going to die off from any system of medicine's way of looking at it, and there will be functional difficulty. People may come to you, people come to me all the time, that I would say this person potentially might get a stroke because they have all the other signs of yang rising and they're doing nothing about it, and their lifestyle and what causes their entrapment is getting worse and worse, and they're of a particular age group as well. So the likelihood is that this is a person who may very well get a stroke. I would be aware of that. What would I do about it? Well, I would move qi and I drag qi down. Move qi, of course, liver qi, that is, with liver 3, gallbladder 34, and pull it all down everywhere you can on the spring points. I always do that. Gallbladder 43 bilaterally, probably stomach 44 bilaterally, why not? Urinary bladder 66, liver 2, for example. All these points, pull them down. Pull down a distal point on the Sanjiao channel as well. Sanjiao number 5 is a very good point for rising yang in the Sanjiao channel, but you can also pull it down at Sanjiao too, but I personally prefer Sanjiao number 5, but that's my own preference. But you get to know the type of person who perhaps has a predisposition to stroke, the age group, the rising yang, the fact that the person seems unable to make a connection between their lifestyle and their ill health, and expect you to have some kind of a magic solution with a magic needle. But I'm afraid it doesn't work like that. You have to take a detailed case history, and any system of medicine can just provide a fire break anyway to allow you to explain to the person where their signs and symptoms are coming, to make the connection, to give a prognosis, and to give advice. And whether or not they act on that advice, I mean, there's not a lot you can really do about that. We're all individuals. Many people will come, of course, after a stroke, maybe years after a stroke. And what are they likely to present with? They're likely to present with serious dysfunction of a limb, a leg or an arm, for example. If that happens, and if with the passage of time, the contractile fibrils, the elastic fibers within the muscle may well have been replaced by non-contractible tissue. So as a result of that, the person is stiff, the person might have contractures, the person is going to has lost all function for a very long time. If you're lucky, you'll see them before the elastic fibrils within the muscle have been replaced by non-contractile tissue, so you'll be able to do something. What do I do? Well, I think it's very important to keep function going regardless. I like using, I won't use the word enjoy, I like using electroacupuncture for the very simple reason it replicates what the muscles are designed to do, to expand and contract, and that's what you want to do. Use a bit of moxie to heat them for the very simple reason qi isn't moving up and down, and if qi isn't moving, cold is setting in. And if you heat muscles will move much easier under electro. Would I cup them? Difficult cupping on limbs at the best of times, but I'd be very careful because, of course, these are muscles that have lost their contractibility maybe with the passage of time after a stroke, and it would be easy to tear them out of their insertion, so you need to be extremely careful about that. But certainly gentle electro is very, very helpful, and it can work extremely well if the person presents to you in a timely way after their stroke. If a person comes some years later, I don't think there's very much you can do. Perhaps you can prevent some of the worst of the contractures by gentle electro, and then getting the person to extend and contract manually their arm or their leg or whatever it might be, or for a carer to do that for them. But at that stage, a lot of damage has already been done. So to summarize, stroke is extremely common. Stroke is described as a cerebral, an episode of cerebral, the words just slipped me there, and from a Western medical point of view, an accident, cerebral accident. And when that happens, what do you do? Well, there's a bleed in the brain, and therefore the brain loses function. That manifests in the human body. So what you've got to do there is you've got to sort of move the qi around. If it's a clot, yes, you've got to move the qi around as well, because these are two manifestations of the very same thing, but they manifest in a very different way from a pathology point of view in the brain, but it manifests in a very similar way in the human body because there's loss of function, generally of a limb or of an arm. And of course, it can be worse than that as well, depending on which part of the brain is affected and how extensive the problem is. There's another final problem as well. A small number of people are walking around with the potential for this to occur without a rise in blood pressure, and they're people who have a prehevanescence or a genetic predisposition to getting a stroke. It's called a berry aneurysm. Very often it might manifest in a relatively young person, and when that happens, then it's necessary to screen all family members, because you may very well find somebody else within the family that also has a weakness in a cerebral artery, and that's called a berry aneurysm. An aneurysm is a bulge in the wall of an artery, and if that happens, it's only a matter of time, very often, before it blows out. Certainly if there's any rise in blood pressure from a Western medical point of view, or rise in yang from an acupuncture medical point of view. So that's a very quick run round, I suppose, the whole area of cerebrovascular accident. That's right, CVA, cerebrovascular accident, or stroke, or from our point of view, yang rising or qi stagnating in cerebral arteries. Thank you very much indeed.